guests. It'll be my pleasure to introduce our guest speaker for your lunchtime entertainment. And I have known our guest, Dr. Hannah Brown, for a few years through social media. And Hannah is a lover of science. And for those of you who may be on social media, particularly Twitter, may know her as Dr. Science Lover. So I'm really pleased to have met Hannah now in the flesh since moving to Adelaide. And Hannah is the science communicator, so the chief science storyteller for SAHMRI. And I think that Hannah's got a few stories to tell. So would you please welcome Hannah to give her presentation. So thank you, Hannah.
Thank you so much. It really is an absolute privilege to be here today. It's something that's been a little while in the making, and I actually learnt a bit more about it on the way here. I was talking to Sean a bit about what it is that Rotary does. Wasn't super familiar, and he talked to me about the National Youth Science Forum, and that's actually how I got an invitation here. So earlier in the year I spoke at the National Youth Science Forum here in South Australia, and I met Mike, who said, we would really love to invite you to come and talk a bit about what SAHMRI does and tell some of the wonderful stories that are happening at SAHMRI to Rotary. So I'm really grateful that that connection was made and that we sort of share this that SAHMRI and Rotary share this kind of interlocking connection through science. So the first thing I should do is acknowledge the Kaurna people as the traditional custodians of the land. This is really important to SAHMRI, and the reason that it's really important to SAHMRI is because SAHMRI holds the world's, I guess, biggest and most successful group of Indigenous researchers. The Aboriginal Health Equity Group at SAHMRI is about 70 strong, and more than 70% of them identify as Aboriginal or Torres Strait Islander. And they're working to create health equity for Aboriginal and Torres Strait Islander people, but also for other people and other minorities across South Australia, which is something that we are immensely proud of, but a reason that we should always recognise the Kaurna people as the traditional custodians. Myself, I'm actually a scientist by training. I got a PhD at the University of Adelaide, but decided that I wanted to jump the fence to share the stories of science across Adelaide and I guess with the world. So these days I have the privilege of doing that at SAHMRI, at the Cheese Grater on North Terrace. I am the chief science storyteller, and I guess what that means really is that I get to take the amazing stories that exist within SAHMRI and help them get to the right people. And so sometimes it's speaking at events like these, but other times it's speaking with doctors or with clinicians, making sure that the great discoveries that are happening at SAHMRI are getting out of the building and are reaching the people that really need to hear about it. And I guess that's really important to us at SAHMRI because a lot of the research that's supported at SAHMRI actually is supported by the general public. You know, we receive research funding from the federal government, which is derived from taxes, and that means that we have we feel the expectation that we should be taking really important information to the people who helped facilitate and allowed medical research to be done in the first place, and that means we need to think really carefully about how we deliver information to people. So has everybody been to SAHMRI? Has anyone not been to SAHMRI? Oh, we would love to welcome you in at any time on a tour. I have some handouts here today with some more details on how to get in contact with us, a little bit about what we do. And I'd also be happy to pass out my details. If any of you would like a visit at any stage, either to bring in a group of Rotary members or also to just bring in a group of people from outside, we would absolutely love to welcome you into the building and talk to you a bit about what we do. I know that there are some very keen SAHMRI supporters, and we're some people that we're very lucky to have as supporters here in the audience today. So at SAHMRI, what we're really doing is hoping to create amazing health solutions for everybody. We're really focusing on vulnerable populations. In fact, we're very close to a number of researchers here today based at the Women's and Children's Hospital in a group called SAHMRI Women and Kids. So we're very focused on those mothers and their young children, making sure that they have the very best start to life. And as I mentioned, we have this big group of Aboriginal and Torres Strait Islander people, and we're very we have a strong focus on making sure that health is delivered equitably, and that making sure that any discoveries that are made don't make health less equitable than it currently is. And then we're taking great cutting-edge approaches and technologies which will allow us to prevent and treat any new diseases in a personalised way. And that's really important to us. We take the patient and the person at the centre of both discovery and of healthcare really seriously, which is why we formed a big group that works specifically on that, and I'm going to tell you a little bit about that in a minute. So SAHMRI is a non-for-profit organisation. We run at a significant deficit. Medical research is incredibly expensive, but we are very lucky to have lots of great supporters across South Australia, corporates, personal supporters, and also to receive some funding from the state government. So I thought what I would do today is share a story from each of the 4 themes or groups or challenges that we have at SAHMRI. There are some amazing stories coming out of the building, but I thought that I would perhaps talk about some that are a little less discussed, some that perhaps haven't made the news, some that you may not yet be familiar with. So the first one I thought I would talk about is a project from the Aboriginal Health Equity Group. And it's a project that I probably couldn't, I've been at SAHMRI 20 months, and I probably couldn't have fathomed it being a project in the medical space when I first started there. But what I learnt was there was a research group in Aboriginal health that was studying the impact on wellbeing of the reclamation of languages lost as a result of the stolen generation. And so I guess you don't know the things you don't know or you haven't considered, but I'd never really considered that the impact of the stolen generation meant that hundreds of languages were lost across Australia, and the impact that that may have in a health and medical space. And so we have an amazing project based out on the west coast of South Australia, where they're looking at the benefits to both wellbeing and also to health on reclamation of Indigenous languages. They're doing that through song, and they're also doing that through the use of amazing phone technologies, apps on phones to help capture language that once existed from people who may not have captured the language in any other way, and then measuring the impact on wellbeing. The really early data suggests that it's having immense benefit to the community, both from a wellbeing perspective, but also we're seeing improved health across the scale. We don't really understand what that means yet, but we do know it's of immense value, and that project will be rolled out across the country with learnings from communities from South Australia. There's lots of amazing research going on in SAHMRI Women and Kids, and I'm going to talk about a story that's probably been popular. Some of you may have heard about it, but some may not, and it's an extraordinary project looking at making sure that babies are not born too soon. So we know that in Australia, about 1 in 8 babies arrive too early, with a burden on the healthcare system of more than $1 billion annually. And so one of the research groups within that Women and Kids theme based at the Women's and Children's Hospital are looking at ways to prevent them from being born too soon. The research that they've done over the last 20 years, but that has culminated in the last year or so, shows that if women take a simple supplement, omega-3s, the kind of fats that are found in salmon, in the last stages of pregnancy, or the middle and last stages of pregnancy, that we can significantly reduce the number of babies that are born too soon with no apparent negative side effects. So it's something that we're very excited about, that we're engaging with state government about, and that we're very hopeful will mean that we can make enormous savings to the healthcare budget just here in South Australia, but hopefully on a more broad scale. This is really important because there are lots of long-term implications for being born too soon, for arriving prematurely, and so we hope that we can both help babies be born at the right time, but also limit the kinds of learning and developmental challenges that they have long term. A super exciting project that's happening there. We have a group of individuals at SAHMRI in a challenge called Lifelong Health, and it's exactly what it sounds like. These people are working really hard to make sure people live long and live well. And there are lots of individuals in this challenge working on obesity and diabetes and neurodegenerative disorders like Alzheimer's and dementia and even wellbeing. And I think there's a really there are an amazing group in there working on nutrition. Many of you may know or may have met Professor Gary Widdett in other places in your life, but he's an extraordinary man working in nutrition and doing a lot of work, particularly in men's health, but he's very interested in how we eat. And just before I began at SAHMRI, December a couple of years ago, the story goes that the general manager from the convention centre walked on down to SAHMRI and asked the security guard if he could speak with someone who works in nutrition. And the security guard introduced him to Gary, and they got chatting, and what they realised was that the convention centre were really interested in feeding people better. They feed more than 1 million people annually, and they were interested in making sure that when people were coming to the convention centre, they were getting something delicious, but they were also getting something that was really good for them. And perhaps it was because all of this biomedical stuff was moving into the precinct that sort of once used to be a skate park and really just housed the convention centre and not much else beyond that. But perhaps it's only something that is now possible, this walk from the convention centre to SAHMRI, that's possible now. We've brought Adelaide Biomed City Precinct together. And so over 6 months, which is probably the fastest that any information has ever got to what we call translation, which means turning it into action, they created a brand new menu. The chef came down. Gary put a lot of rules and regulations around exactly what was going to happen. And they created a brand new menu called Honest Goodness. The story that you probably don't know that's kicked out of that what I think is extraordinary, meaning that people are eating well at the convention centre as a result of evidence generated in medical research, is that what happened when the chefs, because the chefs hold such a big position in the supply chain in South Australia, feeding so many people annually, they had to go back to a number of local producers and say, actually, we're looking for something with less nitrates or less preservative or lower in salt. And what many South Australian producers did was alter the products that they were producing to produce something that was better matched with the evidence on what people should be eating. And so while everyone now at the convention centre is eating that, actually we're all eating that, because lots of those suppliers supply food chains across South Australia. And that means that what we're getting, there is bacon with less salt and less nitrates here in South Australia, and you're getting it on your shelf as a result of medical research that happened right here in South Australia, which I think is quite an extraordinary story. And I'm just going to tell you one last story very briefly about Professor Tim Hughes. He's an amazing researcher working in the cancer theme, and just last week he and a group of clinicians and researchers, and in fact a couple of patients with chronic myeloid leukemia, the cancer that he's working hard to eradicate, summited Mount Kilimanjaro. So for the last 12 months they've been raising funds to support research into chronic myeloid leukemia, and also to create opportunities for developing countries to diagnose and treat chronic myeloid leukemia better. And just last week they summited Kilimanjaro, having raised almost $500,000 for research. So it's not just research that happens in our building. We're very focused on taking the amazing discoveries that happen and turning them into action in other places. And I think the Convention Centre is a great story, but I think that Tim understanding the needs of his patients and wanting to make sure that patients across the globe are able to get the kinds of personalised and precision treatments that he's creating through him going out and fundraising is really important. And in fact, from what I've learnt today is really well aligned with the vision and the mission of Rotary. So it really is truly a privilege to be here. I think perhaps on another day you may have heard about some of the amazing things that are happening, potentially that are coming in the precinct. Sean may have talked to you about Proton Therapy and SAHMRI too. If you drive down North Terrace now, you'll notice that there is commotion next door to SAHMRI. We've filled up. We have more medical research, amazing global leading medical researchers than we can fit, which means we're building a new building which is going up next door. And along with that means that we are able to put in a proton therapy machine which will revolutionise the way young people and people with very difficult to treat cancers get cancer therapy here in South Australia and in fact across Australasia. So I really just want to take the opportunity to thank you for inviting me to speak and for giving me the floor. I think actually that, you know, the mission of SAHMRI is to leave the world a better place than when we got there, and it seems very well aligned with the Rotary. And so if there are opportunities to work together to raise money or to support important causes in the health space in the future, we would love to work together. Thank you so much.
Okay, thank you very much, Hannah. Nice to hear some nice stories from a storyteller. We've got plenty of time for questions, so I don't know where the microphones are, or there they are. They're making their way through. So we've got a question here from Peter.
Thanks, Hannah. Thank you, Hannah. A terrific presentation, lots of stories. I'm sure there are a lot more that you could tell. I'm interested in the culture and the environment in which you work. It seems to me from an outsider that it would be a very exciting, challenging and rewarding one, but you work there. Tell us about what it's like to work at SAHMRI.
Look, it's amazing, and it's funny, right? People talk about culture and they say, oh, in other places I've been, we have a very collaborative culture. We're open. They talk about being fast and friendly and flexible and fun, which are some of the things that we pride ourselves on at SAHMRI. But it is really different at SAHMRI than other research organisations I've been in, and I think the reason it's different is because SAHMRI was a brand new organisation 6 years ago, and everybody coming knew that they would be in this extraordinary building, but they knew that there wouldn't be walls, that there weren't offices, that all of our executive direction was out with everybody else. And I think that what that did was create a culture of sharing, and a culture where we simply have hierarchy, but where everybody's voice is respected. And it's something very different that I haven't experienced in other places, but I'm super proud of at SAHMRI. We really do share. We see amazing collaborations that are starting to happen across all of the groups. In fact, we had lots of what kind of looked a bit like silos 12 months ago, which is why we broke them down and created 4 pieces that are very collaborative, but give everyone a place to be. It's different because we share, and I think that's sort of spreading out across the precinct now too. What we've realised in South Australia is, if we want to compete with the Eastern Seaboard, which we absolutely do, what we need to do is work together, and we're stronger together than we are independently, which means that we can create opportunities for shared infrastructure across the precinct, lots of which are housed at SAHMRI. We have an amazing imaging facility. We have some detection facilities for proteins, a mass spec facility. We have some amazing cellular diagnostic facilities that are open for the entire precinct but are based at SAHMRI, and vice versa. There are amazing facilities in the universities who are partners of SAHMRI who we work with. So it's different at SAHMRI, but it's different in a really good way, and I think something that we're trying to share more broadly and something we're really proud of.
Thank you for that story. I think it's a great story for everyone. Thank you for that story.
You can yell, I'll repeat.
Thank you for that story. Is that better?
I'll do my best.
You're absolutely right that South Australia will not compete in Australia unless it collaborates with all the resources in the state. In your talk, you did mention the 3 universities, which are actually very good universities in the context of the global environment. The Royal Adelaide Hospital. How do you actually include these in your, I suppose, recognition and promotion of SAHMRI? That's my question.
Yeah, we talk about those relationships a lot because they are super important to us. So all of the universities plus the CSIRO and a European database group, EMBL, are all founding partners of SAHMRI. So SAHMRI is made up of people who can either work for or are employed by those organisations and are employed by SAHMRI, which makes us a little bit different, but it sort of opens the doors to those kind of collaborations across the precinct. And so I guess what we really need to work on, I guess, as a state, and SAHMRI needs to really focus on too, is talking about the narrative of what's possible across the Adelaide Biomed City precinct now that, we have 15,000 or more people coming to the precinct every day. the precinct's worth the best part of $4 billion in investment, with probably an additional $2 billion to come when the Women's and Children's Hospital and SAHMRI 2 comes. So, you know, it is this world-leading space, and it's only through collaboration and through working together with SAHMRI's partners and, you know, with organisations like the hospital that any one of these things are possible. But, you know, what is possible now is that you take the, you know, the really fundamental discovery science that's happening within universities. It passes through SAHMRI, where we're very focused on making sure that it's ready to deliver to health, and then making sure we're always working with health to make sure that they're ready for whatever it is that we're creating, and that we're creating the things that they need. So we certainly spend a lot of time working with those partners. All of those groups have a position on our board at SAHMRI, which I think really helps to create that sort of unity and continuity that's really important to deliver things to health here in South Australia.
We've got one over there.
I'm an academic in a slightly different discipline, but one of the things I know is the mammal field, economics, and probably similar in a lot of sciences, is if you look at the chain between your scientists, kind of like university PR, media, journalists, there's a lot of times you get things get embellished, twisted, and so on, so that you kind of like, what you start out with is not actually what then in the end gets represented. So how do you as a storyteller kind of like make sure that you keep the scientific accuracy from what is actually there, yet kind of like fulfill like the audience that the broad public actually understands, or kind of like it gets put in a format that the media is actually willing to put out?
Yeah, so that's a really good question, actually, and something we've worked really hard on since I arrived at SAHMRI, because what we certainly didn't want to do was to take any more fake news to people, and we certainly did. We wanted to stop saying things like groundbreaking and world first, because actually every time a scientist goes in and learns something, it's those things. Like, that's actually what's happening. You know, we are breaking ground every day, but we don't need to say those things. And so SAHMRI goes about it a little bit differently. The first thing we did was go out and negotiate our relationship with the media, and we said, we'll provide you great stories as long as you maintain integrity. And if you don't maintain integrity, we'll work with other people. And that's really helped. But internally, we've worked really hard on it too. So we created a brand new program called Communicate with Impact, which we're putting lots of young budding scientists through, teaching them how to tell their story, teaching them how to work with the media in a positive way to engage and to share information. But I guess the other thing that's really unique about SAHMRI, and something that doesn't really exist yet across the precinct, is that we have, even represented on the board, we have a real focus on community engagement. So at the very beginning of research, right through research governance, through delivery of research, and then through taking research to the people, community involved really across the board. They help all kinds of decision making, but we certainly spend a lot of time sitting down with general community members and other interested bodies to talk about, you know, if we were, you know, we've made this discovery, how should we tell people? You know, do we have the message right? Have we simplified it, or have we made it accessible enough that people will think that this is for them? And so I think we're taking a multi-pronged approach, because I agree, science in the past hasn't done a super good job of that, and we do really have to continue to work hard to make sure that science is taken in a really, I guess, accessible and engaging way to the people who really need to hear about it.
Thank you very much. I'm surprised the other day, a friend of mine is having a risk replacement. Does one understand the operation? Does SAHMRI do operation?
They don't, so I'm not sure they're coming to SAHMRI. They might be popping next door to the hospital, but SAHMRI does have. So what we do is a number of clinical trials, and we do see clinical patients in SAHMRI. So lots of the scientists within SAHMRI are still practicing doctors, which I think helps to identify what it is that are the greatest challenges in health, you know, the things that they are seeing. But we do have an amazing imaging suite as part of SAHMRI, so you can come and get MRIs and ultrasounds and all kinds of fancy images next door. And we do have lots of clinical trials embedded, but no surgery. Maybe they're popping next door to the hospital.
I've got a question. I think it's been a very interesting address. Professionally, I'm a chartered accountant. Also, I'm a registered company auditor through ASIC. And in that capacity, we have had for quite a number of years the opportunity to audit the acquittals of grant programs for the University of the ESA, the medical research area. And what I really want to ask you is, I think that this process convoluted is actually a bit of a negative insofar as the scientists who are doing the research, when they're getting probably 2/3 way through their research, they've got to think about what's the next thing. And I'm curious about your comment about what sort of efficiency loss is there in that process, and could there be a better way? And for those members who are not aware, all of these grants that happen in the research area have to complete, firstly, a tender, then payments are paid on an approval basis throughout the term, which might be a year, might be 2 years, might be 4 years, and there's an acquittal report prepared in an annual basis, and then at the end of the research. So there's a lot of paperwork for these research scientists. So if you'd like to comment about this, I think there's got to be a better way.
There has to be a better way. And look, I think we're seeing some real changes in how grants are dispersed in Australia right now. But the reality is that we are losing great people, that the success rates of at least grants in the medical health and research space, although it's not much better elsewhere, are as low as 8%. And that there is this, extraordinary amount of bureaucracy that happens across all aspects of granting. And many of these people, actually, a good majority of them, I'd probably say that maybe there is 1% of medical researchers in South Australia actually have a continuing position. So, these people are not employed in an ongoing way. They're fighting for grants and fellowships to support their salaries and the salaries of the people around them on an ongoing way, sometimes as often as every year. And we do need to shuffle up what that looks like, and I guess that's one of the benefit of, we, with SAHMRI, reaching out to corporate partners and building relationships with community, is that, we do have lots of really generous people starting to support, particularly the young up-and-coming researchers for whom it's really difficult to get into this really competitive scheme, to do amazing research, to create track records and trajectories that mean they'll be funded long-term. But it's hard, you're right, the bureaucracy is a lot, and we're processing probably $25 million annually worth of grants, and that means that we're taking these great thinkers away from thinking and onto bureaucracy, and there should be better ways to do it. And I'd certainly be open to a chat about any ways that you think we could speed it up for researchers so that they get to spend more time thinking and doing research. The negatives is hard. We, the researchers are encouraged to publish what they do, and there isn't a journal for negative results, and so, unfortunately, so no one really wants to talk about it. And what that means is that that sometimes that isn't done well across the board in science, not just in medical research. We're really encouraging. We created a bunch of opportunities, and I think this kind of speaks to the culture of collaboration at SAHMRI, to make sure that people are having these sort of cross-disciplinary conversations on a more regular basis. We have created a funding model which supports young researchers, people who are just out of their PhD, to work on projects with other young people in completely different areas to try and support sharing of information. And we have lots of internal ways to share information that are sort of not the traditional email-y kind of thing, but we do encourage, we have a seminar program internally just for internal people. So we share what's happening in the building, we talk about the things that are hard, we talk about the learnings, we work together to solve problems. It is, and as I mentioned, it is kind of different. That is one of the greatest challenges, is that there are a lot of failures in science. There's a lot of things that don't work, and finding ways to learn from those and to share those learnings is really important. I think we're having a good go at it, but I think it's something that science could work on more generally across the board, to make sure that people weren't treading in other people's footprints of things that didn't work.
Tim Hughes. One of the things that I think is really important, and I've had a bit to do with research in various universities here, when SAHMRI was first conceptualised, you had some brilliant leadership in that the first architectural designs were pretty
I hope you didn't hear that from anyone.
But what can you as a storyteller do to try to overcome some of that great classic South Australian negativity for what is really one of the great research centres which worldwide can be known because of its iconic building?
Yeah, that's a bloody good question. We talk about it a lot, right? Because you can imagine Raymond Spencer and Alan Young probably didn't do a whole lot of thinking about how expensive it would be to clean SAHMRI. I think that anyone who cleans a lot of windows, and I'm not suggesting that neither of them do that, but the windows are very difficult to clean. And maintaining a building like this is expensive, but in fact it's not all that much more expensive than it's probably not more expensive than maintaining any other building. And I think that we sit from a perspective that what brings amazing people to SAHMRI and what keeps them at SAHMRI and in South Australia is the extraordinary building. In the vision of John Shine and Alan Young, who created the Shine-Young report, who said that we should create something that really is beautiful. We did that, and we've proved it works because it's full. And I think so. We do talk about the fact that we have managed to fill it at a speed that we would never have been able to fill it at, perhaps if it looked like other buildings. We talk about the fact that we need to expand. We talk about the fact that we didn't wash the windows for 3 years because we knew that there was lots of stuff happening. But I guess it's really hard because one of the greatest challenges is getting the balance on marketing and the balance on research right. And what we don't want to do at SAHMRI is spend research dollars on marketing. And so we proceed cautiously and carefully. But yeah, we certainly, I heard, in fact, David Bevan said that we had David Bevan at SAHMRI and his ABC show a couple of Mondays ago, and he spent the morning there, and one of the text lines said, SAHMRI's really expensive and it must be expensive to clean, and he said, well, the ABC gets $1 billion a year and maybe we should give that to medical research. And it's a really hard one, right? But we do our best. But I certainly think if anyone gets the opportunity, if you do hear someone say that, you can remind them that there are extraordinary things happening on the inside. We really rely on the advocacy of people across South Australia to share what they know is happening on the inside and to connect the right people up. And one of our donors recently told me that they think that SAHMRI, when they're flying into South Australia, it looks like a bejeweled brooch on the chest, on the proud chest of Adelaide. So, I think if we can describe it like that moving forward, that maybe we're there.
Okay. All right. Thank you very much, Hannah.
Pleasure.
There's a certificate apparently, but I don't have it. So Hannah will be presented a certificate acknowledging contributions made to the End Polio Now.
Excellent.
In your name. And would you please stand and thank Hannah in the usual way? And I'll hand back to you.